Hey everyone, I want to have a talk about what it's like trying to get healthcare without insurance because for more and more people, that's not a short-term thing, it's just the reality of life now. Maybe, like me, you lost your job recently, and with it went your coverage, or your job never offered it to you in the first place, or the premiums were just too high to keep paying. And when that happens, even basic care starts to feel out of reach. You catch a cold, your back goes out, something feels off, and your first instinct isn't to get it checked. It's to wait it out and hope it goes away, not because you don't care, but because nobody ever tells you what any of this actually costs. And uncertainty can get in your head. Is this thing gonna be $100 or $1,000? Do I have to fill out paperwork? Will they even see me? I didn't know what to do. I kept putting it off, telling myself it's not urgent. But I came across Sesame and saw I could book something right then and there with a price that made sense. And for the first time in a long time, I could actually get the help I needed. So today we're gonna go over Sesame, how it works, what it can do for you, and whether it's worth checking out if you're feeling stuck without insurance. When you don't have insurance, care isn't just expensive, it's so hard to navigate. There's no roadmap, no way to know what anything costs until after you've agreed to it. A basic primary care visit might be $150 or $300. An MRI could be $2,000. It's all a black box. And unless you already know exactly where to look, those prices just aren't listed anywhere. You're expected to go along with it and just hope you figure it out later. Some people can turn to public clinics like FQHCs, and sure, those can help, but A, only if you qualify by income, and B, only if there's one near you. Appointments are limited, wait times are super long. It's not the kind of thing you can count on when something is urgent. There's always direct primary care, but that's a monthly subscription. It really only works if your needs are very simple and your income is steady. Most people don't want to commit to a membership. They just want to get in, be seen, and know what they're paying. So you wait. You stretch it, you let things go, not because you want to, but because the system makes doing nothing feel safer than doing the wrong thing. And that's what I really love about Sesame. It's not just the pricing, it's how different the whole thing feels. Because it's not insurance, and it's not one of those half measures where you still end up filling out forms or waiting for someone to approve you. It's just care. Priced clearly, listed plainly, and available when you need it. I didn't have to create an account or sign up for anything, just search for what I needed and booked it. The price was right there, but so was what the visit included, when I could be seen, whether it was in person or virtual. A lot of the time, you can get in that same day. And once I saw that, the tension I'd been carrying around for who knows how long finally eased up. I didn't have to wonder if I was doing it wrong. The doctor sets their own rate, gets paid directly, and that's it. There's no billing office, no paperwork trail. And because there's no insurance involved, the cost is always reasonable. It feels like someone finally built something that understands what it's like to go without coverage, to get lost in the system. And when the visit was over, I didn't feel stressed. I felt like I'd actually been helped. Then after that first visit, I started thinking about all the things that I've been putting off. The skin issue, the rash that I've told myself was nothing. A checkup I hadn't done in, 3 years? My old doc said I needed blood work, but I never followed up on it. I've been carrying all of that, but without insurance, there was nothing I could do. With Sesame, I could finally take care of myself. There are over 300 services on there across more than 30 specialties. Primary care, dermatology, women's health, mental health. You don't need a referral for any of it. If it's listed, you just book it. They've also got lab work and diagnostics in a lot of areas. You book those the same way. Search, pick a provider, pay up front. And if you need prescriptions, most of the generics start around $5, with free delivery included in a lot of the cases. So no need to go to a pharmacy. Just fill out the form and it shows up at your front door. Now, a few visits in, I did decide to sign up for their membership. It's called Sesame Plus. Now, you don't need it, but if you're planning to use the site more than once or twice, it can save you a bit of money. It's $11 a month or $99 for the year, and it knocks $10 off every appointment. The annual plan also comes with a full lab and blood test workup. I didn't even know that was part of it, actually. I just saw it show up when I went to book another visit. Like I said, I did wait on getting this for a bit. I wanted to make sure the platform actually worked before adding anything extra. But after a couple of visits and a month where I needed, 3 different appointments, I figured I might as well. It made the math easier and it took one more thing off my mind. Now, just a quick heads up, this video is actually sponsored by Sesame, and if you want to check it out for yourself, there's an affiliate link in the description and in the comments below. It doesn't cost you anything extra, and we might earn a small commission, which does help out the channel. And sometimes we can even get you some special deals that you wouldn't find if you went straight through their website. So one of the biggest shocks came when I actually compared what I paid through Sesame to what I used to have to pay. A basic primary care visit would run me anywhere from $150 to $300, depending on the clinic. That's for something as simple as a sinus infection or a stomach issue. That same kind of visit on Sesame averaged around $54, sometimes even less. I've seen them start at $47. Then psychiatry is another one. I've been quoted everywhere from $100 all the way up to $400 or more for a single session. On Sesame, those start at $49. And we're talking about board certified professionals here. These aren't some undergrad interns. Even things like prescriptions are so much simpler. The cost of the medication plus the visit still came out cheaper than just the visit alone would have been anywhere else. And before I got fired, I never realized how much more people without insurance get charged. We're the ones paying up front, but we're also the ones stuck with the highest list prices because there's no way to negotiate. It's not just unfair, it's backwards. This totally flipped that. Everything's priced before you book. There's no billing department, no middleman. A doctor sets their rate and you decide if it works for you. And the next time something comes up, something weird or uncomfortable or just inconvenient, I have a way to deal with it. That's new. Now, it doesn't mean I won't still think twice sometimes. That's just how it is when you're paying out of pocket. But I don't feel stuck the way I used to. I don't feel invisible, lost. I've got a tool that works when I need it to. That's all I wanted. If Sesame feels like something you might want to try out, there is that link in the description and in the comments section. That's where we usually find special offers that aren't available on their main site, so feel free to check it out. Also, if you're interested in working with us or sponsoring a future video, just reach out using the email in the description below. So I hope you enjoyed this one, and if you did, I would really appreciate if you liked the video. And subscribe to the channel. If you got any more questions, feel free to drop those in the comments as well. Look, the medical system in this country can be a tad challenging, so I try to do my best to help out as much as I can. Otherwise, thank you so much for watching, and I will see you in the next one.